Hello, welcome to another video, and today I'm going to be giving you two examples of two exercises that are common to losing control of the lumbar spine in particular, and this is where we see excessive extension that can lead to crushing of the SIJ, so with sacroiliac joint, and just creating extension related back pain. And so I've got Mel here showing us a squat and also overhead press. Now, if I'm just going to play that squat one just back a bit, and I'm going to bring it to about here. Alright, and then this overhead one. So these are two exercises that demand quite a fair degree of extension. Mel's very strong, but at times she gets a bit of neck pain, and she has a chronic left hip problem that's been there for a long time. But her biggest problem of late has been neck pain, and I'll explain to you what's going on here. She doesn't actually get lower back pain, funnily enough, unless she does too heavy on these exercises, especially glute loaded ones. And she'll get it right in the SIJ, right around there. All right. So, but what she does, which is quite a unique thing for her, and you can sort of see it on the squat more, is that she gets an excessive amount of thoracic extension. She doesn't really get, and this is where her lordosis, which is the curve here, this is where people sort of assume, too much anterior tilt. If anything, Mel has a posterior tilt. You can almost see here, she's sort of almost tucking her butt under, and you'll see it when she stands up on the squat. If I just play that for you, you can sort of see when she does do that, unconsciously just sort of tucks her butt under. But as she gets fatigued on both of these exercises, she gets her back starts, and you can almost see it on this one here. See the little creases in this region of her back here, and she just starts to really overextend. She gets excessive thoracic extension. You can see how like this part of her back is like almost flat. There's no like kyphosis that you would normally see. So in order to get like the weight going straight above her, what she does is, instead of using her pelvis has almost gone under. It's almost flat. So to give her the position, so if she didn't overextend here, she'd be pushing the bar in front of her, which would be too heavy and it would fall. So to counter that, she's just developed a strategy of compensation where she overextends the thoracic spine. Now, many people think they don't have enough thoracic extension and they're too much kyphosis. Well, Mel's the exact opposite, and when that happens, and you can also see it here in this, where on that squat, if I just play that again for you, and I'll just clear, you can sort of see the squat here, and right there you can almost see it really crunching right up. So she has only got a bar here, but if we loaded it, she wouldn't be comfortable at all, and this left leg would probably compensate and try to get away, and then this lateral flexing on the spine and everything. So she's got pretty good form, and actually her form on the front squat is a better choice. The front squat actually forces her into a little bit of flexion and actually gives her a little bit of the thoracic kyphosis that she's lacking. But you can see here there's almost like no kyphosis at all, and you actually sort of need some. And the reason that she gets neck pain is because these scapula are sort of closing in together on each other, so that this one's coming this way, this one's coming that way, and this is really, all the rhomboids and the middle traps, they get really, really tight, and anyone who has neck pain knows that that area is going to lead straight into headaches and going up into the back there. So correction for her, and then you lead to wing scapular problems. So the correction for that is a lot of push-ups and working on actually giving her kyphosis back. But the other real underlying problem is this pelvis sort of tucking under. So she sort of needs to get a bit of more anterior tilt, which would actually, if she can work on getting a bit more of this kyphosis, she'll resolve the neck things, which is why one reason she hates the overhead press and is not as strong with it, because there's a poor scapular timing to it. She just can't derive strength from this poor position. So it's very subtle, like you might be looking at this thinking, I don't really see anything too wrong with it, but But when you understand that she has pain and you sort of look for these things, and you can really see it there, how much she wants to like overextend right there, and just like no help from the pelvis at all. So this area is just going crazy, and then it's going to crush that lumbar spine. That's the sort of what we were starting off at the beginning. So both of them are crushing the spine right into that lower area. So that's an extension. This is an example of extension-related back pain, and 2 exercises that will really bring it on. All right. So I hope that helps explain some of the things that I didn't really get to go over in the longer video. Make sure you check the description underneath, because I'll chuck some links of things on what you can do to correct it, but I just wanted to use this video as something you can use to identify compensation going on, and more importantly why it's happening. Alright, so I hope you enjoy that video, and we'll see you on the next one.